Good day, folks. Thank you for joining us here at Your Health. Merry Christmas to all and happy holidays to everyone who hears my voice. On today's program, we'd like to talk about the dietary supplements that help us attain a healthy cardiovascular system. Heart disease is the #1 killer in America, so the need is there. Please stay tuned to learn more about that topic. But first, let's go to our news. Let's see what's happening in the health world. When infants and children take probiotics daily, it reduces their need for antibiotic use. Researchers from Georgetown University Medical Center reviewed 12 previous studies. They found when kids take probiotics daily, it reduces their need for antibiotics by about 30%. When the researchers considered only the highest quality studies, they found daily probiotic use reduces children's antibiotic use by 50%. Each year, there are at least 2 million cases of antibiotic-resistant infections that result in over 23,000 deaths in the U.S. alone. Related research from the University of Alberta finds, from an animal study, the first microorganisms introduced into the intestinal tract of newborns persist well into adult life, and this colony of bacteria has a profound effect on future overall health. This study was published by eLife. Well, this is amazing, isn't it? I hope you are paying attention because there is true power here that could spare you and your loved ones much suffering. Here we learn when babies and children are given daily probiotics, it reduces infectious disease risk and hence their need for antibiotics by about 50%. Now I'm thinking of all those kids with middle ear infections, sore throats, bronchitis, and asthma that are given round after round of antibiotic. If we would only give our kids daily probiotics and feed them yogurt, cottage cheese, sour cream, and other probiotic-rich fermented foods, we could reduce their disease burden and their suffering. Also, we would spare them from the inevitable side effects of antibiotics, which are considerable and often severe. To date, we know from top-quality research the regular use of probiotics leads to fewer infections, shorter duration and severity of infections, less antibiotic use, and fewer sick days from school and from work for adults, and more. We also learned from an animal study when newborns are given probiotics with their earliest feedings, it establishes a colony of healthy intestinal bacteria that persists all the way into adulthood. One can easily speculate and reliably speculate that this healthy colony of gut bacteria established in infancy will also translate into improved health throughout life. Now, in the interest of holism, let's add a nutritious diet. Vitamin D, and a quality multiple vitamin complete with vitamin A and C, zinc, and the essential B vitamins. Add a little exercise and good daily hygiene, and it is absolutely possible that we could reduce our antibiotic use by as much as 80%. This is within your reach, but it's up to you to make this happen. Parents blame electronic devices for their teens' sleep problems. Researchers from the University of Michigan surveyed over 1,000 adults with at least one teen. They found 43% had a teen that struggled with either falling asleep or staying asleep. Over 50% felt an electronic device such as a computer or cell phone was playing a major role in their teen sleep problems. Other causes of teen sleeplessness included homework, school, and social issues, along with health conditions and medications. Related research from the American Psychological Association finds 1 of 3 college students worldwide, get this folks, 1 of 3 college students worldwide report psychological symptoms that would qualify for the diagnosis of at least one psychological disorder. The study evaluated over 14,000 students from 19 colleges in 8 countries. This study was published by the Journal of Abnormal Psychology. This is unbelievable, isn't it? 1/3 of all college students surveyed reported symptoms that would qualify them for a diagnosis of a major mental health disorder. This finding fills my head with questions, as I am sure it does you. For example, are these psychologists simply drumming up business, lobbying for more college counselors? Or have we become overly lax with our definitions of the various mental health disorders, not wanting to leave anyone out? Everyone gets a participation trophy, you know. Have our children become so weak and ill-equipped due to the abundance that we have provided for them that they cannot handle the stresses of adult life and now need a diagnosis and a pill? Well, who knows for sure, but I will say this. Our first story provides at least one clue to the answer. Our kids, and many adults for that matter, are so wound up with the use of these electronic devices that they have become completely disassociated with the things that provide us with the essentials for a well-balanced psyche. I'm talking about the things that provide affirmation, confirmation, soothing comfort, and sleep. I'm talking about the things that provide us with both physical and mental health, healing, and growth. It would be rare to find these rewards from an electronic device. They are, however, found in a wholesome lifestyle, complete with exercise, a healthy diet, and in-person social interactions, and a true sense of purpose and accomplishment. Parents, also please understand, teens by their nature often have trouble falling asleep. This is due to the incomplete development of their circadian sleep-inducing biorhythms. They often have low sleep induction hormone levels such as melatonin and others during their teen years. Think of teens as being on a 25 to 26 hour day. It often takes them longer to fall asleep, and the use of blue light emitting electronic devices makes their problems with sleep even worse. Well, today on Your Health, we'll discuss supplements to a healthier heart. Stay tuned to learn more.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
I'm Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For Your Health at a Glance, I'm Dr. Richard Becker.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Welcome back and happy holidays, everyone. I hope you are enjoying this most blessed time of year wherever you are. Well, today's show is going to be quite interesting. Sit back and listen because we're going to learn how we can have a healthy, heart-smart holiday. So Richard, keeping our heart healthy and going is
Yes.
so important, especially as we age, and there's things we can do really earlier in life to help prevent these issues from hitting us as we age.
Oh, absolutely. Prevention is the key to a long, healthy life. And folks, today's topic is one of the most important topics we ever discuss on this program. And it does contain the power. The information we'll discuss today contains the power to change lives and to relieve suffering. And I don't take that claim lightly. I have some personal experience in my own life with the power of CoQ10 and magnesium and carnitine, D-ribose, fish oil, and how it's improved my life. So it's not just what I've read and learned from studies and working with patients, but it's my own personal experience. So what are we talking about today? We're talking about coenzyme Q10, L-carnitine, D-ribose, magnesium, and fish oil. This is the awesome plan that helps nourish the heart and keeping it beating strongly to perfuse our bodies with life-giving oxygen so that you can reduce your angina symptoms, shortness of breath, dyspnea with exertion. You know, you're fine as long as you're lying down or sitting in an easy chair, but as soon as you get up to walk across the room or to go to the grocery store, oh my goodness, I don't know if I can do this. You know what I'm talking about. If you have heart disease, you know what I'm talking about. First subject, coenzyme Q10. It's also known as ubiquinone. This word ubiquinone comes from the word ubiquitous because ubiquinone, or CoQ10, is found in virtually every living form on this planet. We can't say every life form because not every life form has been tested, but from the highest animals, human beings, all the way down to even bacteria, ubiquinone is there. It is very important in transferring energy into cellular energy. So the foods that living things ingest and turning that into energy that powers our cells. This ubiquinone was first isolated some 60 years ago at the University of Wisconsin by Frederick Crane, and he won a Nobel Prize for that. This was a big thing. This was a big understanding in how living things transfer energy into life. CoQ10 plays a critical role in the conversion of glucose into ATP. All our food stuff, whether it's a protein, a fatty acid, or sugars, they are eventually converted to glucose, and that's what our body breaks down very slowly to release its energy, and as it releases that energy, the energy is converted to adenosine triphosphate, or ATP. And this is what the cell uses. So think of ATP as the American dollar. You can go anywhere in the world and use a $100 bill to get what you need. You know what I'm saying? It's recognized everywhere. What's kind of like that in our bodies? ATP is recognized everywhere as a source of credible fuel that will power our body's many uses. ATP. And with this ATP, all of our aerobic respiration occurs. Aerobic, the use of oxygen to create energy, that's aerobic energy, that accounts for about 95% of our energy source, 95%. And let's make this practical. If I were to hold my breath, I could live, if I'm in really good shape, 4, maybe 5 minutes, if I'm really in good shape. If you're not so good a shape, maybe 2, 3 minutes you could hold your breath. That is what you get from one breath of aerobic respiration. Without that going on, only 5% of your energy needs are met. We can't live long without breathing. Makes sense, doesn't it? Aerobic respiration, ATP, glucose to energy, and CoQ10 is a key step in making that happen. CoQ10 is also a vital antioxidant, and it prevents the oxidation of cholesterol plaques in our arteries. The plaque itself is not a problem. When it becomes oxidized and inflamed and disrupts, breaks loose, and creates a clot, as it were, that goes through the artery and then eventually lodges, that's where your heart attack, stroke occurs. If we can keep these plaques calm, get the inflammation out of them, they don't break loose nearly as easily. And everybody has plaques. 18-year-olds have plaques. Everybody has them. What changes? Well, they become inflamed. They become inflamed, and then they break loose. CoQ10 source is primarily made by biosynthesis, meaning we make it for ourselves. You can get a little in food, but it's not enough to meet your needs. Our bodies make CoQ10 for us, but it is a complex system that does this. It involves 12 different genes, 17 chemical steps in the past, 17. It's like a production line of making a car almost. It's a long process that has to be done exactly right or it doesn't come out right. Requiring at least 7 vitamins and several trace elements, by its very nature, CoQ10 production is vulnerable. Low production is common. Things we do in life. With advancing age, coexisting health conditions, medications, these things can all lower our CoQ10 level. And what happens when our CoQ10 level is low? We're not exchanging energy. It's like holding our breath. That's what happens, basically. And our aerobic oxidation to release energy is compromised dramatically. Accepted normal levels are low. In other words, if you were to have your CoQ, you say, well, I wonder if my CoQ10's low. I have angina. I have some trouble with that. I wonder if my CoQ10 level is low. Go to the doctor, they test it, and you're right at that low normal. Well, you're normal. That's okay. Well, no. According to the world's leading experts in CoQ10, accepted normals are too low. They need to be higher. It needs to be a little higher than it is. So, when CoQ10 levels are low, the symptoms of heart disease emerge. What are they? If you're low in CoQ10, you're going to experience more chest pain, shortness of breath, dyspnea, difficulty breathing with the air hunger, with exertion, moving around. Oh, I just can't keep up with it. Fluid accumulation in the body. You can't get rid of your fluids as easily. Body aches, fatigue, and depression. It creates a mental cloud in you because your brain is not oxygenating as well as it should. It's another problem. High energy organs have the most CoQ10. Well, what are your high energy organs? The ones that have the highest metabolic need. The heart, the brain, the organs, the liver, the spleen, the kidneys. Then the muscles, when they're active, they have a high metabolic rate and they have higher levels of CoQ10. So anywhere where we have normally high levels of CoQ10, that's where you would develop the symptoms if your levels are low. Claudication of the muscles of the lower extremities, this type of thing. Statin cholesterol-lowering drugs, which millions of Americans are on, lower CoQ10 levels. This is well accepted. And there's been a lot of recent research that confirms that speculation. It's not speculation anymore. I'm talking about your Lipitor class, your statin drugs. These are so commonly used today. They lower CoQ10. Now, I want you to think about this for a minute. Now, I'm all for preventing heart disease, and if you meet criteria to take a statin drug, I'm not saying that's the wrong thing to do. But here we are giving a drug to prevent heart disease when one of the complications of the drug is to lower CoQ10 levels that can lead to heart disease. There's got to be a better way, don't you think? But statin drugs are not the only ones that lower CoQ10 levels. Beta blockers. Almost every heart attack victim in America gets placed on a beta blocker to help calm the heart so it has less risk of a second heart attack. Well, it would even be much less risk of a second heart attack if you take CoQ10 with it, because beta blockers lower CoQ10 levels as well. Sulfonylureas for diabetes. These are drugs that lower glucose levels for the diabetic. They lower CoQ10 as well. Thiazide diuretics, one of the most commonly prescribed medicines to lower blood pressure in the world, also lowers CoQ10 levels. There are other medicines like chemotherapy agents, age, and coexisting disease, all lower CoQ10 levels. Now, after these important messages, let's return and talk about the research supporting the use of CoQ10.
Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings. Or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
I'm Dr. Richard Becker for Your Health at a Glance. Do you have a family history of a certain disease? Scientists are discovering that our genetic code plays a smaller role than previously believed. Only about 20% of disease is tied to our innate genetic code. So what determines the other 80%? The answer may lie in the emerging field of epigenetics. What is it? Epigenetics is a group of changing factors responsible for both how our genes are read and how they are then applied throughout the rest of the body. And this may explain why identical twins with identical genes can have different health problems. Researchers believe two of the main factors in epigenetics are nutrition and environmental exposure to toxins. So eat a healthy diet, reduce toxin exposure, and you may improve your own epigenetics. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone, learning how we can have a healthy Heart Smart plan for a great Heart Smart holiday. Well, Richard, CoQ10 is amazing. I'm glad you do that one first because, I don't know.
It's the big star.
It is just amazing. So now you have some research, and I'm sure you have some new stories in there, too.
You know, folks, before we start on the CoQ10 research, please understand there is not a pharmaceutical giant behind this wondrous substance, CoQ10. So you're not going to see it on the evening news. You're not going to see ads during the evening news or your favorite programs. It's not like that. It cannot be patented. God holds the patent. That's how I like to think of it. But there is research there just alike. That's just how it is. Now, what does this research show? CoQ10, if you have angina and you take CoQ10, what happens? Multiple studies show CoQ10 in angina, reduced chest pain, less chest pain. I could stop right there and it's worth taking. But there's more, less medicine for your chest pain, fewer hospitalizations. You've already paid for your CoQ10 right there. If you just have one less hospitalization a year, you paid for all your dietary supplements for the whole year. Think about that. That's worth doing, and you're staying out of the hospital, which is a very good thing. Also, better performance on the stress test when you go to the cardiologist or your internist, and the doctor's happier too, because you're on CoQ10. If you have mitral valve disease, you have fewer irregular beats. This is one of the things the mitral valve people always say, I get these flutters in. It's just so disconcerting. You'll have less of that if you take CoQ10. Better exercise tolerance and less fatigue for mitral valve disease. Coronary artery bypass grafting. That's the bypass of the heart. You've heard of this. thousands, hundreds of thousands are done in the United States every year. Patients who take CoQ10 around the time for their bypass graft, 3 out of 4 of these patients have lower glucose levels. Lower glucose means your energy transfer is more efficient. See, if it's not efficient, the glucose rises. And what happens with an elevated glucose? You inhibit healing. You don't want that. There are fewer arrhythmias, which is the arrhythmia is what gets you in trouble, serious trouble. You don't want the arrhythmias. Fewer arrhythmias, less medication to pull you through the operation, less drainage from the surgical wound, fewer blood products needed. That's always a benefit, and a shorter hospital stay. All of this from taking CoQ10 around the time you're needing your bypass graft. It should be on the formulary of all hospitals in North America, in the world. That's my personal opinion, and it's Dr. Sinatra's opinion as well. Everybody should be using this. Just because it's not made by a drug company. What if you have cardiomyopathy, heart murmurs, valvular disease, improved ejection fraction? In other words, the heart is able to pump more blood out with each contraction. Improved diastolic function. The diastolic function is the siphoning action, the pulling of blood into the heart. It's priming the pump. It actually takes more energy to prime the pump than it does to eject the fluid out, the blood out. So that's what goes first. Loss of diastolic function. It can't draw it back, and you build up with fluid. CoQ10 strengthens the heart, allowing it to siphon in the blood to eject it out. Does that make sense? It does, doesn't it? Because it's critical. It's critical understanding. Also, we have less hypoxia with cardiomyopathy and heart murmurs and valvular disease. If combined with selenium, it reduces the death risk. CoQ10 and selenium are awesome together. What about heart failure? Heart failure is what put CoQ10 on the map. 43% reduced death risk. You're able to walk. 43% reduced death risk. Think about that. If we had a drug that did that, it would be on the nightly news every month. You can walk further in heart failure, exercise longer, reduce disability rating, better stress test performance, improve blood pressure. Keep the pressure down, you improve heart failure remarkably. If your blood pressure's up with heart failure, that's a tough row to hoe. Endothelial dysfunction improves. That's the brain center of the artery. It's better able to control the diameter and flow of the blood through the artery. Better endothelial function. That's what that's called. With time, reduces the enlarged heart size. Improved ejection fraction. Less shortness of breath and pain, while quality of life improves. And again, combining CoQ10 with selenium prolongs life at least 4 years. Those studies that made this discovery that CoQ10 and selenium work beautifully together, they have been extended now, and it's been confirmed with the extended study out to 14 years, I think it is now. And the dose to meet that study requirement was CoQ10 200 milligrams, selenium 200 micrograms. That's what they used. Now, it is possible that a higher dose would be longer, and a lower dose would last just as long, but we don't know. But we do know that the 200 milligrams CoQ10 and 200 micrograms of selenium will prolong life, statistically prolong life in heart failure. Hypertension lowers blood pressure 11 systolic and 7 diastolic points. These are double-blind placebo-controlled trials, folks. Atherosclerosis, arteriosclerosis. CoQ10 softens the artery over time. Helps arteries to dilate, improves blood flow, so oxygen can get where it needs to, so you can make more energy to fuel your needs. That's basically how it works. Stress-induced cardiovascular disease. This is the executive who's under the gun. CoQ10 combined with garlic reduces death risk by cardiovascular disease induced by stress by 75%. That's remarkable. Lowers the calcium in the arteries, calcification of the arteries, helps to lower that. Healthy patients with exercise tolerance, they can work longer, work harder with less muscle energy soreness and oxidative stress. Healthy patients taking a statin drug for cholesterol lowers their CoQ10. If you take CoQ10 with your statin drug, you will improve your leg strength and your anaerobic threshold with fewer muscle cramps, pain, and fatigue. Cholesterol lowers CoQ10 lowers LDL, the bad cholesterol, and it raises HDL cholesterol by about 3%, so that's good news. And in the diabetic, this is a new area of research with CoQ10. CoQ10 improves the long-term hemoglobin A1C, your average long-term. It reduces diabetic medication, lowers oxidative stress and inflammation for the diabetic, and reduces blood pressure, prevents elevated insulin levels, improves artery and nerve function. CoQ10 helps to negate diabetes-induced cardiovascular disease risk. That is a huge thing. That can help, that alone. But you know, folks, there's so much more. There are other agents involved, and we're going to talk about those when we return.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. I'm Cindy Becker, and this is Your Health at a Glance. The next time you're buying meat, look for low-fat, uncured, unprocessed meat in its natural state. Why? A low-fat, natural meat diet could be the healthiest of all. Research from Harvard University compared processed meat diets with natural meat diets. The extensive study involved more than 1 million people in 10 countries. The scientists discovered a diet of processed meat that contains preservatives and nitrate-curing agents, such as bacon, sausage, and deli meats, increased the risk of heart disease by 42% and diabetes by 19%. They also found natural meats, free of these curing and preserving agents, did not raise the risk of heart disease or diabetes at all. So shop for lean, uncured meats free of additives and in their natural state. For Your Health at a Glance, I'm Cindy Becker.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. We're back, everyone. I've got to let you know it is holiday savings time at BioInnovations. I know many of you wait all year for this time, best prices of the season, and free shipping on orders over $50. Of course, that's the mainland USA, but you don't want to miss it. This is a great one. It's a really good time for you to get that HeartSmart plan so you can have a HeartSmart holiday. So Richard, going through all of this information is so interesting. CoQ10 was amazing, great research. Now we're going to talk about the counterpart to CoQ10, that's L-carnitine. Yes. CoQ10 helps turn glucose into energy. L-carnitine helps turn triglycerides or fatty acids, the fats in our bloodstream, they're normal, they're supposed to be. L-carnitine turns these fats into energy. So to have them both supported and elevated is a real benefit. L-carnitine is an amino acid produced by the kidneys that shuttles fatty acids into the cardiovascular system, into the cells to help that be converted into energy. It supports the conversion of blood fats into energy in the vascular tree. 60% of the energy used by the heart and the blood vessels comes from these fatty acids. So we do not want to ignore them. That's why L-carnitine is a critical component of this plan. In myocardial infarction, when we study how L-carnitine improves the lives of those who have a heart attack, we find L-carnitine reduces your risk of death, mortality from a heart attack. It reduces the infarct size, the damage to the heart, improves the ejection fraction. Remember, that's the part of the blood volume that gets ejected out. It has to be efficient. If it's not efficient, you're repumping the same blood over and over again. That's not good. That is stressful on the heart. So improving ejection fraction is a very, very good thing. You are less likely to suffer a second heart attack if you take L-carnitine with a heart attack. You have less chest pain, less abnormal heart rhythm, better exercise tolerance, and lower heart failure complications. The long-term complications of a heart attack, the big one that gets us is the heart failure. So less risk of that if L-carnitine is involved. There are other aspects of cardiovascular disease that L-carnitine helps. Atherosclerosis, or this one we're talking about claudication. This is a narrowing in the blood vessels, the arteries in your thighs or in your abdomen, so that your leg muscles don't get enough blood and hence oxygen. This limits your ability to ambulate, to move about. For example, as long as you're walking in the home to the kitchen and back, it's okay. But as soon as you go out to the mailbox, oh man, my legs feel like they're on fire. Well, that can be claudication doing that. What they've learned is, from a 17-study review of L-carnitine and claudication, L-carnitine improves the pain-free walking distance from 23 yards or meters on average, up to 123. That's a 100-meter advantage. That's about 106, 105 yards. That's tremendous. And maximum walking distance from 9 to 104 meters. So it's it is within the realm of likelihood and probability that your claudication, you can now go to the store, and if you pace yourself, you can walk the aisles and you can get your shopping done. Or maybe it's just taking care of your own home a little better. This is the kind of thing we can do with L-carnitine and claudication. Heart failure also improves walking distance. Cholesterol and triglyceride, this is a very attractive feature of L-carnitine. L-carnitine may dramatically drop triglyceride levels. And this is due to the fact that L-carnitine shuttles fatty acids, triglycerides, into the cells, mitochondria, so they can be used to create ATP. If you have high triglyceride levels, try a little L-carnitine. You're going to get some benefit from there and cut the sugar out. Those two steps help the majority. Not everybody with high triglycerides, but the vast majority. What else? Dialysis, people in chronic kidney failure. L-carnitine with CoQ10 lowers LPA, lipoprotein A, in dialysis patients. Dialysis patients really struggle with heart disease. And it is due to a lot of reasons, but the lipoprotein A is really the big indicator of potential heart disease, not only in dialysis patients, but in all people with potential heart disease. And lowering lipoprotein A is a big deal. That's really what you're trying to do, not lower cholesterol. It's much more effective to be lowering lipoprotein A. That's the goal. L-carnitine decreases time to fatigue for dialysis patients. Post-exercise tolerance is improved, reduces C-reactive protein. The inflammation of the kidney is reduced in chronic kidney disease when they take L-carnitine. Dr. Rich Schneider, nephrologist, great man, very caring. He loves L-carnitine for his chronic kidney disease patients on dialysis. Oh, you know, you always need to clear things with your doctor. But if they say, oh, that stuff doesn't have any merit, boy, I'd seek another opinion, because it does matter. And it is well studied. There's a lot of research on this now. Asthma. Deficiency of L-carnitine makes asthmatic children symptoms worse. Kids can take CoQ10 and L-carnitine if they have a need. There are children born with mitochondrial defects, and they have very weak muscles, their hearts are weak, and supplementing CoQ10 has now been proven to raise their levels and improve their life. It doesn't cure their disease. It's a genetic disease. It doesn't cure that, but it relieves much of their suffering, and worth doing for children. It's safe in children. It's in all our bodies anyway. It's not a drug, see? That's the beauty of this stuff. There's no drug side effects. It's just a beautiful thing. All right, here's one that many men want to know about, erectile dysfunction. Here's your combination, men. L-carnitine, the amino acid arginine, and vitamin B3 niacin. Those three things, L-carnitine, arginine, and niacin, improve erectile dysfunction in 77% of the men who suffer from it, without the side effects of those blue pills, without those. Amazing. Well, when we return, let's talk about D-ribose. This one's fascinating too. We'll be back.
Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year, and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. During this holiday season, think of the words of the English writer G.K. Chesterton, who said, "When it comes to life, the critical thing is whether you take things for granted or take them with gratitude. No matter the size of our problem, Jesus cares." The Apostle Paul gave the Philippian church this advice in Philippians 4:6. "Do not be anxious about anything, but in everything by prayer and petition, with thanksgiving, present your requests to God."
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. We're back, everyone. I just want to give you a quick reminder. It is holiday savings time at BioInnovations. Fantastic prices, best prices of the season, and free shipping on your orders over $50 in the mainland USA. So definitely a good time to get that Heart Smart plan for a healthy holiday. So Richard, next on the list is D-ribose.
Yes, D-ribose is what's called a non-reducing sugar. It's a 5-carbon sugar. That means that we don't use it to burn fuel. We use D-ribose to make that ATP molecule we've been talking about, the dollar bill, the energy dollar bill to our bodies. 5 carbon sugar molecule. What this means is if you take a teaspoon of D-ribose, it does not raise your blood glucose. Diabetics, you could use it as a sweetener for your tea or whatever, and there's no caloric content to it. It's used directly to make your ATP. D-ribose helps CoQ10 and L-carnitine fulfill their roles because there's plenty of base ingredients to make that ATP that CoQ10 and L-carnitine are there to help do. Makes sense, doesn't it? And multiple studies have shown when you use D-ribose, it improves fatigue, shortness of breath, chest pain, exercise tolerance, and when taken alone, that all occurs, but it works best when we use it with this group of supplements we're discussing today. If you ingest a lot of D-ribose, over 60 grams, which is 12, 15, almost 20 teaspoons of it, who would do that? Well, who would do that? If you take that much of it, it can lower your blood glucose levels because your body seems to think there may be sugar there, but there's not. But we're not taking that much. You can take 2 or 3 teaspoons 2 or 3 times a day. That really does help the fatigue that you may be experiencing. Make it a part of the program. You know, when you have your iced tea, just put a little in it. It's perfect. Then you'll have enough base ingredients to make your ATP to nourish your vascular tree. Magnesium, this one is critical. Magnesium, it is an essential mineral that's used in over 350 different metabolic enzymatic reactions. Multiple studies have shown in populations with low magnesiums, they have higher rates of cardiovascular disease, and diabetes increases. In the United States and North America, as you go west, magnesium levels drop in the groundwater, and that's our primary source of magnesium, but it's also in whole foods. So a healthy diet and supplementing your magnesium helps to promote this whole process of energy exchange. And what this is basically is the ATP molecule, adenosine triphosphate. There's 3 phosphates hooked in a row, and magnesium cradles those phosphates and equilibrates their charge. You know how magnets want to come together? Well, the phosphates have a charge to them, and that is countered and stabilized with magnesium in solution. I know this is chemistry, but without enough magnesium, that ATP falls apart. It can't do its job properly. Plus, the magnesium is used in 350 enzymes to do all the things we do. Low magnesium is a big problem. You don't want it. Support it with a little magnesium supplementation. Now, in recent years, fish oil has received a lot of criticism from pharmaceutical companies who want to erode the sale of their heart drugs. I'm not anti-medicines. We need medicines. We need them. But we also need as many tools in our toolbox to help people who are suffering and to save lives. Why would you discredit something good when your product is perfectly fine on its own? I don't like to work that way. I don't want to discredit any of these medicines. They're valuable tools. Let fish oil stand alone. So what I did was I went to the research and looked at the 100 most recent double-blind human studies on fish oil and their benefit. And I want to read to you some of the benefits of fish oil that has just recently been proven. None of these studies were funded by a pharmaceutical company, though. Not a one. I checked on them. What do? What do the omega-3s do? They reduce triglycerides. They reduce the risk of sudden death. They reduce cardiovascular disease death. They reduce heart attack risk. They reduce plasma viscosity. The blood flows better. Reduces red blood cell rigidity so the little blood cells can bend and get into the nooks and crannies where they do their job. Blood cells don't do much in the big vessels. They do it down in the capillaries where they have to squeeze in. The red blood cell squeezes in better. It improves systolic blood pressure, reduces blood clot risk, improves heart rate variability. The heart can respond to stresses better. And it improves the nervous system control of the heart. It improves the risk of heart attack after stent replacement in high-risk patients. Improves angina in cardiac syndrome X. This is microvascular angina. There's not a blockage of the artery to the heart. There's dysfunction in the capillaries, like what we just talked about. That's cardiac syndrome X. They also call it microvascular angina. But fish oil helps to lower that. Let's see, lessens the risk of a stress-induced heart attack. Mechanism defined. EPA, component of fish oil, reduces blood clots in men, and DHA reduces blood clots in women. Amazing. Reduces the markers of inflammation known to predict high risk of sudden cardiac death. Reduces that risk. Improves endothelial dysfunction in smokers. That's control of the artery. It's improved in smokers. Improves heart rate variability and chronic heart failure. Reduces the risk of fatal coronary artery disease and sudden cardiac death in diabetes. Reduces cytokines and markers of oxidative stress while lengthening white blood cell telomeres. In other words, the white blood cells live longer so they can better do their job when we supplement with omega-3s. Reduces the risk of AFib. There is an epidemic of this AFib out there, and we are a nation with low omega-3 levels. I wonder if that has something to do with it. And on and on and on. I mean, there's so much on it. It's easier to believe, oh, it doesn't help, than to understand what all that means, isn't it? It's easier to believe that. But from your lack of knowledge shall you suffer and perish. It's true, isn't it? Well, folks, we'll be right back for our wrap-up. Stay tuned.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. Cindy Becker, and this is Your Health at a Glance. Do you want to maintain your mental clarity? With people living longer, we need more research into the ways to lower the risk of dementia. Studies are showing us that people who regularly read books, complete puzzles, or solve word games like the Sunday crossword puzzle maintain their mental abilities longer than people who don't. We also preserve memory by maintaining social activities, such as volunteering, attending religious services, or regularly talking with friends and neighbors. And diet plays a big role as well. It's important to eat a nutritious diet free from heavy metals and chemical pollutants, and full of vitamins and the essential fatty acids which power the brain. These simple and important steps will help keep you mentally healthy for many years to come. For Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. Your Health is brought to you by BioInnovations, trusted products for your health and well-being. We're back, everyone. Just a quick reminder, it is holiday savings time at BioInnovations, so don't miss it. Fantastic prices. Okay, Richard, this hour has just flown by. Let's talk about the Heart Smart plan and how we supplement with it.
Yes, CoQ10, how much do you take? A typical dose is 30 milligrams to 90 milligrams a day. That would be anywhere from 1 to 3 of these gel caps that Cindy's offering us today. But some people will have to take up to 1,200 milligrams a day to really get help with their heart failure. If you need 1,200 milligrams a day, you should be working with a cardiologist. Most will not need that high. Most 30 to 90 typical. Many people 200. To match the study that showed prolonged life in heart failure, 200 milligrams a day. L-carnitine, 250 milligrams per gel cap of the CoQ10 L-carnitine combination. We put those together. Doses 250 a day up to 1,500 a day are very typical. 1,000. At 1,000, you get most of the benefits, most all the benefits of L-carnitine. So up to 4 a day, but you want to match them up together so it's convenient. 1 to 3 of the CoQ10 L-carnitine a day for the vast majority. I would say 90% of the people that would be enough. It takes a couple weeks to get your levels up. So be patient, and you can start with a higher dose to get your levels up and then decrease as you're finding help. D-ribose powder, 2 to 3 teaspoons a day. That's fine for most people. You can do more. If you're having profound fatigue, you'll need to take up to 10 teaspoons a day. And that's okay. That's okay. Magnesium chelate, the recommended amount for women is about 350 milligrams a day and 420 for men, but that's not enough. It's not enough if you're suffering from heart disease. So the magnesium chelate capsules are 250 milligrams, so 2 a day for women, 3 a day for men is the most common. But you may need a little more. Take enough so that we don't want to create loose bowel movements, because you'll lose your magnesium if you do that. Remember, milk of magnesia is a laxative, and it's the same magnesium. So 2 to 3 magnesium capsules a day, men, women, is usually good. Fish oil, at least 2 gel caps a day. Many people will do that and have salmon and fish frequently. I know of people who take 10, 20 grams of fish oil a day with good results. When we have more fish oil than our body needs, we simply burn it up as a fuel. And that's okay, because this type of oil converts into energy very easily without the cardiovascular disease connotation that saturated fats and trans fats and cured meats conveys. So it's all good with that. Well, Cindy, a lot of people are watching this program today who are suffering needlessly. And I'm talking to you today. I don't like to see people suffer. It really bothers me, and I want to help you with it. So have a little faith, have a little trust, put this plan to action, and you never know what good can come of it. I've seen it firsthand many, many times, and I want you to get the help that you deserve as well. Well, it's been a fascinating day. I love this topic because I know how powerful it is. Thank you for your kind attention. Happy holidays. We'll see you, folks.
Thanks, everyone. We'll see you tomorrow right here on Your Health. Bye-bye.
I used to watch professional wrestling as a youngster. One character, Mr. Perfect, always looked healthy and seemed to do everything right. Did you know perfectionistic tendencies may ruin your health? Negative stress triggers heart disease, IBS, and insomnia. So combat stress by meditating on things that are good, especially God's Word. It's not crazy, just healthy.
Next time on The 3, we'll be looking at what is happening in our local courts, federal courts, and the Supreme Court in our nation's election battle. See what has happened and what is yet to come. This season of The 3 is dedicated to America the Beautiful and to praying for our nation, our president, and our government leaders present and future. So whether you're a Democrat, Republican, or a Whig, come let us reason together and see what God is doing and saying in our nation right now.